Hello, everyone, and welcome. We are in Men's Health Month with Dr. Akil Taher, and I want you to know that we're both excited to bring this topic to you today because a lot of people do not understand the importance of knowing that a blueberry can do better than a little blue pill. And Dr. Taher is going to help us to not only see that, but understand why that's the case. So, if you know Dr. Taher, he's a practicing physician, he is a septuagenarian, and he is one who is really an advocate for a whole food, plant-based, vegan lifestyle that really can turn around illnesses. And it's proof by his own story, the open heart story. And if you haven't read his book yet, I highly recommend get your copy of the book. And if you are anywhere where Dr. Taher is, he'll autograph your book for you. But there's so much great information in there that you want to make sure that you're aware of. And really just get it in your heart that a plant-based lifestyle is what can prevent, reverse, and many diseases even cure. So I want to welcome Dr. Taher today to talk about a blueberry or a little blue pill. Hi, Dr. Taher.
Hello, hello, hello. How is everybody? Thank you, Lynn, for that very generous introduction. And let me start by sharing my screen. So today we are going to talk about a blue pill or a blueberry. Now, most of you know that the blue pill, the Viagra, it came around in the early 90s for people who had problems with erection or impotence. Now, I want to tell you that a blueberry or some of the other fruits and vegetables in the plant-based can not only do the same, but even better, because they treat the cause of the underlying erectile dysfunction with hardly any side effects with the blue pill has. So the next slide would be, what is erectile dysfunction? Erectile dysfunction or impotence is an inability to achieve and maintain an erection satisfactory for sexual performance. Now, if erection problems are from time to time, that is okay. But if it is an ongoing problem, then you should worry about cause of concern, maybe a risk factor for an underlying health condition or a risk factor for heart disease. And now, who gets erectile dysfunction? 30 million men in America suffer from erectile dysfunction. Globally, there are 300 million men suffering from erectile dysfunction. Now, this is a conservative number because men don't like to talk about this. See, this is not generally discussed by men at all. Therefore, you've seen so many of these online sites have cropped up with selling pills online. And this is a danger because this is something that we don't know what they're selling. It is not a prescription drug. So be careful about these medications online, because there is a better way. Is a whole food plant-based and certain fruits that I will talk about, certain nuts, which can do the trick as good, if not better. Understanding erectile dysfunction, you must understand the mechanics. of how erectile dysfunction happens. So this is a cross-section of your penis, and this is your normal penis in its flaccid condition, your two chambers corpora cavernosa, and these are not filled with blood, and this is your normal penis in its not erectile position. Now you get an erection if when blood fills these two chambers, and then this causes your penis to expand, get stiff, and get an erection. Now, impulses from the brain and genital nerves start this process. Anything that blocks these impulses or restricts the blood flow to the penis can cause erectile dysfunction. That means there are two things over here. If your blockages of the impulses, the nerves, that is a nerve aspect. But if anything that has happened to your penile arteries, blockages, atherosclerosis, where blood cannot go in, is due to a vascular problem, which is the most common, and that is due to your lifestyle or your food preferences. Now let's take each one. Causes of erectile dysfunction, chronic diseases. As I mentioned before, the vascular problem is a bigger problem, and this you can get in heart disease, atherosclerosis, where you have blocked vessels, high cholesterol, and high blood pressure. Diabetes, a double whammy. You have nerve problems too, diabetic neuropathy that can cause damage to the nerves, as well as a vascular problem, the blood not flowing into the penile arteries. Metabolic syndrome, many people walk around with this, with a high blood pressure, cholesterol, diabetes, increased levels of your insulin, visceral obesity is also a cause of erectile dysfunction. And finally, the Peyronie's disease, where you have a curved, painful erection, and therefore this is treated by medication at times, but mostly by traction or surgery. I have to share, why am I doing this? Just 1 second, please. Let me.
Did you want to do slideshow?
Yes. So I will pay from the current slide.
Yes,
Yes.
there you go.
It looks better. I'm sorry. I completely was off track. So anyway, nothing is lost. Whatever I wanted to tell you has been told so far. Now let's go. Causes of erectile dysfunction again. Next cause is your lifestyle. This is the most important cause. When I practiced medicine, when I was in the clinic and doing practice, and even now, the two most common causes that patient came around when they had an erectile dysfunction was smoking and high blood pressure. Now, alcoholism, excessive alcohol can cause a problem of ED. Remember the saying that alcohol can increase the desire, but decrease the performance. Now, when you talk about drug abuse, so you have drugs like your cocaine or your marijuana or your opioids. These are all drugs called recreational drugs, but they can cause a lot of problem with your lifestyle and erectile dysfunction. And finally, if you're a couch potato and do no exercise at all, or hardly any exercise, you may end up having an erectile dysfunction or ED. Our next cause is surgery. Surgery can at times damage the nerves and blood vessels near the penis area. So if you had prostate cancer, if you got bladder cancer, if you had bladder cancer, surgery for an enlarged prostate can cause problems with the nerves and the blood vessels. Now, I do agree that with the modern techniques of surgery, the robotic surgery, this rarely happens. But I remember 20 years back when a patient came to me, was in his early 40s, and he had cancer of the prostate. We sent him over to a urologist. The surgery was done, and he came back and saw me after 2 years and told me that, doc, I wish I had never had the surgery because I'm totally now, I cannot perform the sexual act, neither am I wanting to. So these things can happen. So be careful when you talk to your surgeon. If you have problems like this, talk about this to your surgeon, that what are my chances of having a problem after surgery. Now, medications. This is an important thing because erectile dysfunction may be a side effect of a lot of medications. Blood pressure medications, like you have your thiazide diuretics, like you have your beta blockers, and then you have the antidepressants like your SSRIs, your Prozac, your Paxil, your Zoloft, and over-the-counter medications. It is extremely important for you to remember this, because the first generation of antihistamines, which you use for allergy, like Benadryl, can cause this problem. NSAIDs, non-steroidal anti-inflammatories, like your naproxen or ibuprofen, taken for a long period of time, can cause ED. Causes, psychological causes. I want to say this thing over here, that if you have early morning erections, then most likely it's not a physical cause, it is a psychological cause. Stress, depression, low self-esteem, performance anxiety. Let's talk a little bit about stress over here. You see, acute stress, to handle it is perfect. Like if you are trying to avoid a car hitting you, or somebody's out to snatch your purse, your sympathetic nervous system goes in an overdrive. Your blood pressure increases, your heart rate increases, your respiratory rate increases. That is when you're pushing your foot on a gas pedal. But the moment this threat is over, everything comes down. Now you're putting your foot on the brakes. Your blood pressure, everything drops, your respiratory rate, and you become normal. This is fine. Now, if you're an oversympathetic nervous system, whereby you're constantly into a state of high blood pressure and respiratory rate, and you're constantly having this, you're going into chronic stress. That is, the inflammation starts, cortisol starts coming out. Cortisol will cause you to eat more, and eating more will cause you a lot of problems of obesity, and then sleep apnea, and then depression, and the list goes on and on. So remember that that is a problem. So try and handle the stress. It's just by not only by medication, does help if other things don't, but try a little bit of meditation, yoga, deep breathing exercises, and get your anxiety level lower down and lower down. Now, low self-esteem can either be a cause or a result of an ED. And performance anxiety, there's so many times I've seen patients come to me and say, look, I have this problem. Well, in short, I always tell them, concentrate on the pleasure, not on the performance. So, and that too can be done so very well in most cases that it can be helped. But remember, psychological is a big problem And if you have early morning erections, most likely you have a psychological cause. Bicycling and erectile dysfunction. You see, being a cyclist myself, I'll tell you, some bicycle seats put pressure on the perineum, an area between anus and scrotum full of arteries and nerves vital to sexual function. So if you bike for many hours each week, you're better off getting a seat which is designed to protect that area. So it's important because a young cyclist and all that can damage the nerves and the arteries. Erectile dysfunction, a sign of heart disease. In many cases, ED can be a warning sign of heart disease. And folks who have coronary artery disease are more likely to have ED. People who go on a whole food, plant-based, no oil diet after having heart disease, and folks who have coronary arteries. Now, people, sorry, I got disturbed with this call. I've just put it on the silence now, so it won't bother me. People who go on a whole food, plant-based, no oil diet after having heart disease, that means even after having stents put in or open heart surgery, report their sex lives have improved a zillion times after going on this diet. That's something to keep in mind. How are ED and heart problems related? See, erectile dysfunction is an early barometer, an early sign of poor vascular function, main cause, the blood not going in the penile arteries. And therefore, it may be an early warning sign of heart disease because penile arteries are narrower and smaller than your coronary arteries, the arteries that supply blood to your heart. So if you find somebody with an erectile dysfunction and does not have any heart problem, this is the time to intervene and prevent heart attacks and cardiovascular disease. Remember, both are due to dysfunction of the endothelium, the inner lining of the blood vessels all over your body. So if your endothelium is disrupted because of, say, your bad food habits and your stress and not having proper sleep, having no exercise, inactivity, then your endothelial lining gets disrupted, and that causes the cholesterol and the calcium and all that to form blockages, atherosclerosis in your blood vessels. So erectile dysfunction too is an endothelial dysfunction. So erectile dysfunction is basically equal to endothelial dysfunction. ED is equal to ED. How strong is the connection between ED and heart problems? This is an extremely important statement. Bear in mind, research suggests that men with erectile dysfunction who have no obvious cause, the slides that I've shown you, trauma, surgery, or psychological causes, and who have no symptoms of heart problems, should be screened for heart disease. It means if you are, say, a 52-year-old man who has got erectile dysfunction and you have got no surgery, no psychological causes, and everything is ruled out, and you have no heart problems, you should still be screened for heart disease. So testosterone. Now we come to the causes of your causes of low testosterone, rather. So in the causes of low testosterone, what we have is aging is the number one. Age-related testosterone decline has been known. Number two is your hypogonadism, which is due to your medical condition where testes do not produce enough of your testosterone, and it may be due to your pituitary gland also, which regulates hormone production. Third is chronic medical conditions can cause lower testosterone. It may be blood pressure, diabetes, high cholesterol, obesity. Medications, again, the chemotherapy medications, your cortisone, your NSAIDs, and your certain can suppress the radiation can suppress the testosterone production. And lifestyle factors, which again is very important. A poor diet, alcohol consumption, smoking, chronic stress, and lack of exercise can all produce low testosterone. Testosterone is not directly related to erectile dysfunction, but does cause eventual erectile dysfunction by causing low sexual drive, or libido is not that much, and therefore you do not have the desire to have sex. Now, what they did was that low testosterone, traditional diet with plenty of meat versus plant-based diet. It's an observational study between men from different dietary groups showed that a plant-based vegan diet had a small but significant increases in testosterone concentrations in comparison with meat eaters. Now, symptoms of low testosterone that is so many times been misdiagnosed as depression, but it can cause fatigue. You don't want to really play. You don't want to really throw a ball at your children or your grandson, and there is muscle mass is lost. You are irritable. You are depressed. Your sexual drive is very low, and finally, it all results into erectile dysfunction. So this is there is a risk of heart disease and stroke for men using testosterone products. So we have to be careful about this. Now, what are the risks of people getting a testosterone therapy? The first risk is your cardiovascular risk. Risk of heart attacks and strokes, especially for older men who have pre-existing cardiovascular disease. Prostate issues. It stimulates the growth of existing prostate cancer or increases the risk of prostate cancer. Hormonal imbalances, that testosterone in your body now starts with the cause of hair loss, acne, shrinkage of your testes, and increase in your red blood cells. Long usage of testosterone therapy can cause liver damage. And finally, you have this prolonged use can also cause mood swings, like you may be irritable or you may be aggressive. These things are noted in people who have testosterone therapy. So I'm saying that even if you are going on for testosterone therapy, please discuss with your doctor, your urologist, that all these side effects and monitor these. In my opinion, if you go on a whole food plant-based diet, you may not require testosterone therapy. Complications are an unsatisfactory sex life, stress or anxiety, embarrassment or low self-esteem. relationship problems, and the inability to get your partner pregnant. Now, let us go a little bit back into history. How was a blue pill discovered? You see, the blue pill was discovered accidentally. In scientists in UK at the pharmaceutical company Pfizer discovered the power of Viagra by accident. In the early 90s, during the trials of a potentially new drug, that UK 92480, which was supposed to be a drug for angina, where you have got constricted coronary arteries, your blood supply to the heart is not consistent, and you get chest pain on exertion, or chest pain or breathlessness on exertion. Now, what happened was and Pfizer was about nothing really. It was found to do little to relieve vaginal pain, and Pfizer was about to abandon this drug when they found a distinctive pattern. Many male trial volunteers were experiencing an unusual side effect. They were getting erections, and the dilatation of rather than the dilatation of the coronary blood vessels as hoped, the penile vessels were getting enough blood, and they became dilated, and they started getting erections. So what happened in this study was that the male participants came around in hordes of people came around. They started calling their brothers, their cousins, their uncles. Everybody lined up for this because this was a pleasant side effect of the blue pill, which was at that time called Viagra. Even now we have Viagra, but it is now generic form too. So the most important thing is to remember that erectile dysfunction, if you ruled out the other causes, most likely it is a vascular problem related to the penile arteries. And what can you do? You have to learn to try and be whole food, plant-based, vegan. That can help. Lose the weight, stop your smoking, exercise, learn how to handle stress, have a restorative sleep about 7 to 9 hours, and avoid abusive substances that we talked about, like cocaine and your other drugs. But there was a Harvard study which was done in, I believe it was a 10-year Harvard study. It was a 10-year study, observational study of dietary habits and sexual function of about 25,000 male students. This was done taking into account risk factors like smoking and diabetes. And guess what? It was found that 36% of those students reported some sort of erectile dysfunction. Now, subjects who ate a lot of blueberries, apples, pears, and other citric fruits had 14% reduction in their erectile dysfunction. Then comes the movie Game Changers. Again, this is an observational study in which there was this Dr. Arnold Spitz, a urologist, who examined the effects of a single meal on erectile function. I believe there were 3 athletes, professional athletes, and they were given one meal that evening of total meat-based, and the second meal the next day they were given a plant-based. And what they showed, that consuming a plant-based meal, participants not only had a better, stronger erection, but also their erections lasted longer. In the same movie, we have Dr. I believe Michael Greger, who found that men who consumed a plant-based diet had a lower risk of getting erectile dysfunction. So how is nitric oxide generated in penile arteries? So you have the endothelial cells we talked about. You have the nitric oxide, which is produced by this endothelial, healthy endothelial cells. Then it goes to cyclic GMP, which causes the blood to rush, swelling of the penis, and erection of the penis. Now, erectile dysfunction drugs also work by increasing nitric oxide and cyclic GMP. But so do amino acids like citrulline and arginine found in your pine nuts and your walnuts, in your pistachios, in your Brazilian nuts, and watermelon, onions, and garlic. Dietary nitrates can also increase nitric oxide. And what are these dietary nitrates? From which foods? Arugula, spinach, bok choy, kale, beets are your top sources in dilating your arteries. Add pomegranates, grapes, and apples and berries, and you are dynamite erectogenic portion, which works better than any ED drug. The reason being that it sort of deals with underlying cause, the endothelium, without any side effects, only good side effects. So these are your powerful erectogenic plant food, your spinach, your lettuce, your arugula, your kale, all different kinds of nuts and all different kinds of berries. Now, female sexual dysfunction, we're not really going to talk about this because it is not in this subject, but what they found is women with sexual concerns most often benefit from a combined treatment approach that addresses medical as well as relationship and emotional issues. It's a much more complex situation than when we deal with men. One drug in one study in which they found a drug, the sildenafil or your Viagra, may prove beneficial for some women with sexual dysfunction as a result of taking your SSRIs like your Paxil and Zoloft, a class of drugs used to treat depression. So in summary, what I would like to tell you is that patients who have coronary artery disease are more likely to have erectile dysfunction. And having erectile dysfunction can be a warning sign of an impending heart disease, most likely coronary artery disease. Now, I have found in my practice that people who go on a whole food plant-based diet after having a coronary artery disease, after having your bypass surgery, after having stents, report that the sex life has improved a zillion times. Differences in erectogenic drugs and whole food plant-based diet to improve your erections in the treatment of erectile dysfunction. Think about it. You are treating the cause of the disease by the whole food plant-based no-oil diet, while in cases of erectogenic drugs, you're only treating that symptom for the time being. Number two, your side effects with erectogenic drugs like blurring of the vision, headaches, sinus congestion, short-lived, but still, these are side effects. And then if you have an erection lasting for 4 hours or more, you have a problem of, you have to go, it's an emergency, you have to go to the emergency room. And you have also the side effects, and imagine the cost. Now, if you are having a whole food plant-based diet, it also lets you have this function, even if you are on your coronary artery dilators, which you're taking. And that is a warning sign that you cannot take if you are taking any of those dilator drugs. So in this case, I believe very strongly that the whole food plant-based diet, including the nuts, the fruits that we talked about, is the answer for erectile dysfunction. And I wish people would talk more often about it, because it is a reason to be worried about. And that is the end. I will take any questions from whoever we have in the audience. Thank you very much.
Well, Dr. Taher, that was very informative. And I don't know if there's anyone in the audience with us to ask any questions, but let me ask you this. What is one of the most frequent questions that you get asked from patients about ED?
You see, the thing is that there is the performance problem. And this performance problem is always due to the fact of not creating a harmony between themselves, talking over things, having a foreplay, which is very important, because there's one of my patients who was given the Viagra at one time in the 1990s, and he came back and said it did not work for me. And I said, why? He says, because I took the pill and I was waiting for an erection. That does not happen. So you have to have the foreplay. You have to talk to your partner. You have to find out things that are there. And that is an issue that most people have. But again, the important thing is, by having a standard American diet or a junk food, vegan or a vegetarian diet, can cause atherosclerosis or clots, or atherosclerosis or plaques in your penile arteries. Because the most important cause of erectile dysfunction is vascular. And if you have that, then the only way to solve that problem is to reverse it. And the only way you can reverse it, proven, is by a whole food, plant-based, no oil diet. So that is the main question and answer that I would give my patients.
That's awesome. And what about stress? You know, you've got someone who's saying, I'm not taking any pills, but they obviously have a large degree of stress in their lives, in their business. What would you tell them as far as somebody who is dealing with stress, and how stress and anxiety can contribute to ED?
Yes, this is where we talk about the psychological causes, and one of them is stress. Stress can cause a problem with your erections, and handling stress is extremely important. So I believe that you use crutches, not just your medications. That is not an answer. You've got to start thinking about your meditation, your breathing exercises, your sky breathing, your yoga, your spirituality, and what have you, to get into the now moment. And then that can sort of help you to ease and peaceful mind, less anxiety, and can work wonders if you can do these few things like meditation and yoga.
Wonderful. I see Debbie has gotten on screen. Hi, Debbie. Do you have a question?
Hey. Yes, I do. So great presentation. And I actually had several questions while you were going through this. And I took pictures of your slides. So one of them, you were talking about your CAD patients and those who changed to a whole food plant-based, and I'm assuming NO is no oil. Right?
Yes.
Okay.
Yes.
So
I believe that if you got a coronary artery disease and you had stents, and if you had a bypass surgery, then even if you've not had these things, it is a whole food plant-based no oil diet.
No oil. Okay. So you say that when they change to whole food plant-based, no oil, that they improved a zillion times. How fast did you see that improvement?
In a couple of months, because
Okay.
it starts working pretty fast. Because even though your plaques have not disappeared at that time, your coronaries are dilating, your penile arteries are dilating. So it
Okay.
does make a difference, And this is remarkable, Debbie, because I've seen people come around and say, Doc, this is amazing. I said, what about your heart? I said, who cares about the heart? I am so happy right now. So it does make, and trust me, any of the listeners later on listening to the recording or what have you, try this out for a few months and see the remarkable results.
Okay. Now, you talked about nitric oxide, and anybody who's heard Dr. Esselstyn talk about heart disease knows all about nitric oxide. So and we know that we get it from a lot of our plants. You mentioned some supplements here, the citrulline and arginine. How effective are those compared to the plants?
The citrulline and arginine are a part of a plant-based. See, if you let me just go over. No, I have.
And while you're doing that, I do also, Debbie, believe that they are prevalent in alkaline foods.
Okay.
What I did have was, I don't know where my slides have disappeared, but I believe very strongly that there were certain nuts, those
Yes.
Brazilian nuts and others that are there.
Walnuts.
The citrulline,
Pistachios, Brazilian nuts. Yes.
those are the ones which can cause your citrulline and all to raise. So it is not supplement. It is still
Okay.
the basis of your nuts that is causing the increase of these substances.
And then he
Similar
also had a
to
short.
watermelon and all that causes the increase in your nitrates, your intake of nitrates. And like your blueberry or your apple or your pears or the citric fruits, so all these garlic, all these things do cause an increase in your nitrates, and that eventually causes an increase of nitric oxide.
Okay, awesome. I'm looking for my next question. So whoever else has a question, that's fine.
Well, I had a question come through about obesity or sedentary lifestyle. Can you speak to how obesity or a sedentary lifestyle could contribute to ED?
Yeah, you see, the trouble is that you need the blood flow in your penis when you are, when you exercise, your blood flow increases everywhere in your coronary arteries, in your heart rate increases. So it keeps your penile arteries clean. But if you are forever into a sedentary slob or a couch potato like I was, then you find that these arteries are now, the endothelial is being damaged and you're forming atherosclerosis, so you're not gaining anything. But if you still keep on exercising, you will get a chance of your blood pressure decreasing, your arteries dilating. So that is a must. And I've seen people who have been just couch potatoes. But remember, it is not one thing like being a couch potato and eating a fabulous whole food plant-based diet. You rarely find people like this and who have no stress and who are having tremendous 7 to 9 hours of sleep. No, this is all hand in hand. You see, if you're not exercising, I guarantee you these people who are doing no exercise, are eating the wrong food, are not sleeping well, have increased stress, are using substance abuse, are smokers who have a lot of alcohol. That is the whole situation, or at least a combination of few of these things.
Okay, thank you.
I got a question on the endothelium. Can you permanently damage it?
Not so, because your endothelial lining, which is damaged, what they say is eventually, Dr. Esselstyn and all that, they've done the research, that if you are over a period of years, you will find your endothelium healing and becoming normal again. But in the meantime, till your atherosclerosis that is there, your plaques are there, you're having a benefit of having your coronaries or your penile arteries dilating and increasing the blood flow. But eventually, when your atherosclerosis disappears, meaning that your endothelial is working, because it
And
is nitric oxide.
so, do some of us make more nitric oxide than others? And, because somebody that has a heart attack, do you think that there's a possibility that they're just not making the nitric oxide that their body needs to make for healthy arteries?
Debbie, I don't have a clear answer, but let me tell you one thing, that not making enough nitric oxide is not related to having a heart attack, because in a heart attack, what happens is that there's clots which are friable, which are premature. The clots are such that they're friable, they're young clots, they break, and they cause a heart attack. So it has got nothing to do with your endothelium, because of why these plaques are soft in some people and why they go on becoming hard over a period of years, that we don't know. But nitric oxide in a healthy endothelium will produce nitric oxide. I have not heard as such about somebody producing more or less. Now, if you are taking the foods that are responsible for the nitric oxide that we talked about right now, then those things can help. Like, for example, when I do my running, if I have not had my juice, which has all the beets and things which are coronary dilated, then I do get tired faster. But if I have those before my run, means I run after about an hour or so, having a glass of my drink, then I feel great. So I don't think that nitric oxide per se is produced more in some people or less people. I believe that endothelium lining, if it is healthy, can produce great amounts of nitric oxide. And the more food that you take, with the nuts and the berries and the pears and the apples and the blueberry, then more nitric oxide is produced. The only difference is that in the penile arteries, your nitric oxide produces cyclic GMP that causes blood to go into your corpus cavernosa and you get an erection. While in your heart, it is a nitric oxide which will cause the coronary arteries to keep dilated, free flow of the blood, and protect the arterial wall.
Okay, thanks for the presentation.
Thanks
Not
for the
at all.
questions, Debbie.
It's a pleasure to always have you, I am open to any subject that you have, and for your crowd next year, whenever you want, I will be very happy.
Okay, awesome. What is your subject next month?
It's a very important thing because, Debbie, last month I found out I had lipoprotein A very, very high. I didn't know that. And I'm a doctor. Extremely high. So my cholesterol levels are high. I cannot bring it down with all that I'm doing. So I talked to my cardiologist and said, why don't you do over lipoprotein A, Mike? And it was 25, 30-fold higher. And there is no treatment for it. And if you take statins, it increases your lipoprotein A.
So are you on a statin still?
I'm not on statins because my lipoprotein A will go higher up. So there is no treatment for it. So what is the best treatment so far that there, because I was in London a while back and I was talking to people over there, they have not found a treatment yet. But the fact is that if you are on a whole food plant-based no oil diet, then it saves you from, even if your cholesterol becomes very high, because your endothelial lining is okay, your blood will still flow with the cholesterol.
So
That's
have you talked to Joel Kahn about LP little a? He has a book out on it that came out last year, I believe, on LP little a. So,
Oh, really?
Yeah, I have a client that has the same issue, and she had a heart attack and had several stents. And anyway, so if you're talking about LP little a next month, I'm going to make sure I have her on.
Correct. I'm not only talking on LP little a, this thing, Deborah, but I'm talking overall. People don't understand this. You know, your little LPA, your cholesterol, your VLDL, your triglycerides, your this, your that. So I'm going to make it as simple as possible for the layperson to understand. And then when they go to their doctors and say, "Oh, your cholesterol is high," they can ask questions.
Right.
What does this mean? What does that mean? You have a right to ask these questions. And I find a lot of people just don't know. Oh, good cholesterol, bad cholesterol. The good cholesterol is in two parts. Your LDL is there, then this little LPA, which is like a Velcro. It is attached to your LDL. So all these things, I want to make it so that people can understand everything that you need to know about cholesterol. That is my subject.
Okay. I will email you the title of his book. I'm not seeing it on Amazon, but I will email that to you so you can get it, because it is a good book.
Debbie, one news. I will be featured in AARP.
Oh, yeah?
In the bulletin, yes, in a bulletin article.
Awesome.
Which goes to about 30 million people. So they just asked me and they interviewed me. So I would like to let you know, because you're one of my close friends.
Well, thanks for letting me know. And I don't necessarily look at that all the time, but I will certainly look at it.
Of course not. You're too young. It's AARP.
Thank you. Thank you. Tell me that in another month, then I'll have to disagree with you.
No, I heard about this thing, and I talked to you and we did discuss that. So I wish you well, really, Debbie. I really wish you all the best.
Well, thanks. Hey, quick question. Are you going to be at ICNM in August?
What is ICNM?
The International Conference of Nutrition and Medicine. PCRM puts it on.
Not to my knowledge, but when is it?
It's August 10th through 12th in Washington.
Oh, I just came back from NHA.
Oh, did you?
Association. I was a speaker there. So it went off pretty well. It was very well received by the people.
Yes.
There were close to 100 million, about 300 people. No.
There were 360 people in person, and there were 503 people registered for the virtual event, and about 300 actually came during the event. A lot of people bought it so that they could have the recordings,
right?
Everything, all the extras to it as well. And so, yeah, and Dr. Akil did an amazing job with his presentation. He talked about his journey, and I mean, he got so many accolades afterwards, people acknowledging him and thanking him for telling that story, because when he started out talking about, I wore 3 hats, and one of the biggest things was, I'm a doctor. I didn't think I was supposed to ever be a patient. You get caught right there,
right?
And want to hear the rest of the story. And he did an amazing job. I was, me personally, so proud of him.
No, thank you very much. I mean, you are all close people to me. I know we are all sharing the same message. We are all trying to, the heart healthy message, healthy living, the whole food plant-based diet. So I'm so happy that I'm here in the present. Thank you.
Yes.
Very
Well,
much.
you have a tremendous message, that is for sure. And
So you can see our July event is scheduled July 14th, Understanding Cholesterol. You will see this, you'll get this with the email when we share the recordings. There's also a page on Dr. Akil's website where all of the Heart Healthy Talks with the Doc are on that page. So we'll be sharing all of that as well. And join us, invite others, share with your groups. I mean, we really appreciate everyone that's been coming and would love to see even more. And Jan, hi.
Hi, how you doing? I'm new, and I'm sorry I'm so late today, but I'm so happy that I can catch it on the replay, right? So
Yes.
I will do that, and I definitely will go to your site and check out the other presentations. It's just great. I really enjoyed hearing what I could hear, since I joined. So
Great.
thank you guys.
Thank you, Jan.
Yeah, thank you so
Jan,
much.
are you new to whole food plant-based?
No, I have been, well, it's been a long journey. I started to not eat meat probably about maybe 18 or 19 years ago, and then let dairy go, gradually, and then found Dr. Furman's book and kind of supercharged my efforts. So I guess since around, I don't know, 2010s, 8, something like that. I've been whole food plant-based. So yeah.
Awesome.
Wow.
Yeah. So I'm sure you guys, maybe some of you have been there longer, but I really, no, really. Oh my goodness.
I'm 7 years.
Oh,
but,
okay.
That's
Okay.
it.
Yeah.
Yeah.
I've really stayed
Jan,
with it.
I am 75 and I'm old, but a new kid on the block.
Okay, well, I'm 72, so I'm right there with you. Yeah. And I just had, I just had a checkup today. I've had 2 cancers in the last couple of years. I had lymphoma and breast cancer, but everything is kind of behaving itself. So I'm really supercharging my efforts on whole food plant-based, because the reason I say this is because I bounced back from everything that any treatment that I had, I just bounced back. I sailed through it. Yeah. So I see the thumbs up. Yeah, it really does make a difference, because people who are a lot younger, they really suffered with the treatment. And so I think there is something to this. So
Yeah.
I'm a lifer on this. So yeah.
And Dr. Christy Funk has a great book out on breast cancer.
Yes.
I hope you've read that.
I had a consultation with her, as a matter of fact.
Awesome.
Yeah.
Great.
My doctor is Dr. Loomis in Dr. Bernard's office.
Oh, yes.
Yeah. So I see him. So I had really good, help along the way. So
Excellent.
yeah.
Excellent. And just send me this thing also, if you can, about the PCRM, when it is. So if I have nothing, then I will. Okay.
Yeah, because I'm going to that, and I would love to meet you in person.
Oh, that would be lovely. Yeah.
I think we've been friends for 3 years, but we've never met in person.
Oh,
really, and that's why I met a lot of people who interviewed me in the National Health Association.
Yes.
I got to meet all those people, and I was so excited to meet all of them who had interviewed me.
Dr. Furman, Dr. Sabatino, Dr. Alan Goldhammer. Dr. Barnard's been there before. He wasn't there this year, but this is actually the annual conference that all of the big guys go to. Dr. T. Colin Campbell was there. It was really a nice event, well-attended event. And to have Dr. Akil on the stage really, I think, added a new dimension to some of the work that they're doing and the stories that they're telling.
Yeah.
Awesome.
Yeah, that is so great. Yeah, I was there virtually, although I didn't get to see your presentation, but I'm going to see it on the replay. So,
Awesome,
yeah,
Jan.
yeah. I was there. I really enjoyed it. Yeah, so good.
Nice.
Oh, it's so nice. You know, the thing that I notice about the plant-based world is everyone is so nice. Everyone is
Yeah.
so nice. You know, there's like this kindness and there's this peacefulness that you really don't see in other groups. Like right now, you guys just embraced me so quickly, you know, and I feel the same way about you. So
Yeah, and remember one thing, people become plant-based for three main reasons. One is because of animal rights, second is because of health, and third because of environment.
yeah.
Wife and my daughter turned 40 years back, became vegetarian. Now they're of course vegan and plant-based, but vegetarian because of animal rights. I did
Yes.
not. I
Oh,
turned because of health. But when I
okay.
turned because of health, my eyes opened to the
Yes.
animal cruelty. My eyes opened
Yeah.
to the
Yes.
environmental, and I started getting deeper into that. So when
That's
you
right.
say that people around you are kind, it is something that happens to us.
Yes.
That
Yes, I think
Most
so.
definitely.
passionate, we become more giving.
Right.
Our mindset changes. My patients will tell me,
It does.
"Doc, what
It
happened to
does.
you?"
Yeah. Yeah. I just have to plug in my computer here. I was
Yeah,
losing
excellent,
power. Yeah.
excellent.
I have to go, guys, but nice
Okay.
meeting you, Jan. And
Oh,
I will
nice to
send
meet
this
you,
to you,
Debbie.
Akil, okay?
Thank
Take
you
care.
for
It's always a
coming.
pleasure. Thank you, Lynn. Thank you, Jen.
And
Bye-bye
thank
now.
you for
Bye.
your
All right.
time and everyone. It was just my pleasure. Bye-bye.
Thanks, Jan. We'll look forward to seeing you next month.
Okay, I'll be
Okay.
here, hopefully. See you.
Bye-bye.
Bye-bye.